So, hi, how are you, Laura Leigh?
I'm great. How you doing?
I'm good, thank you. So, hi, friends. I'm Tia, and this is Laura Leigh, and she's one of our new nurses on our team. I'm so excited to have you a part of the Boots and Wings project and
Thank you.
giving guidance and advice to our family caregivers in some of the areas that they need some just medical insights and some, different kinds of things. But can you just, as a welcome to the team, just tell us a little bit about your story and your background, and then we'll go from there with some of the things we want to explore today as our first introduction.
Sure, great. Hey everyone, good to be here. It's wonderful to be here. My name is Laura Leigh Barbour. I am a person that, originally was raised in North Carolina, but made my way for a 45-year stint in Greater Philadelphia. And during all that time, I've been a nurse that long as well. All kinds of different nursing, and then about a 20-year stint as a nurse midwife and working with families in hospitals and in Lancaster County and at home and the birth center. Mainly, I want to always put in a plug for that great place in Philadelphia, Bryn Mawr. And then I made my way over from some personal experiences and some professional ones to go to the other end of life, the other side of passage, and became a hospice nurse. But I worked in home care as well, home care and hospice. So I've had plenty of opportunity in all those years to sit with people and be with people during times of crisis, hard times when you think you're alone, when you don't think anybody's going to be there for you. And, probably just as importantly, given the chance to work with fabulous teams, where the teams were social workers, chaplains, in all different parts and places in their lives. So I've also taken care of both of my parents when they were passing away. And I also took care of my father-in-law here in my home last year, and he passed away as well. So with some experience in end of life, but also taking care of people at home when you may or may not think you could possibly do it alone, and that might be your thought. We're here to sort of say, yes, probably you can't. And we have together cumulatively a lot of experience that we hope we can bring to you individually, not a cookbook, but to you individually of what you need. So I feel really good and wonderful about the project. So.
Yeah, thank you. And that's where we met. We met in hospice, and I was on one of your teams. I was one of your chaplains and relied. And I think that's really partly where we start our conversation and our relationship, is that the advantage of a team that can support each other in the caring process. And for me, when I was doing my own caregiving, sometimes it felt I was overwhelmed, or I felt like I didn't have a team. And so the work of the Solutions, Caregiver Solutions and Resource Company is to help people figure out, what they don't know, like what do you think you know, what don't you know, where do you feel like you need more information, where do you go to get that? But then also building a team around and knowing what your wraparound team is, figuring out how to define that and what the rules are for you, not for based on the bigger system. But so tell me a little bit about just what you see from, we've both been in the clinical and we've both been in the caregiving, personal caregiving side of things. So as a nurse clinician, what do you see are the big issues that you think our caregivers are facing, like immediately? Like, what are the big issues on a day-to-day basis that caregivers are struggling with?
I see actually people feeling that sense, probably more than anything, that sense of being alone and aloneness initially, because many times when people first start, family or friends might be around when you're bringing a loved one home, maybe from a hospital discharge, or usually, just might even just be a short-term crisis of something you need to do because of orthopedic condition. And maybe someone's newly diagnosed as a diabetic. They're coming home with a lot of information. And right in that discharge time, right when you got those full forces, you might be doing it for several days with help. And then all of a sudden, whoever is that main caregiver, and it could be a couple, it could be a couple taking care of one of their parents. It could be a spouse who just had a stroke at 50. And all of a sudden they don't know how to even offer to help you and be your what we call wraparound team. So that they have actually, they're so overwhelmed by being alone, and no matter what they look at or read out there, they're not trying to sit down and watch long informative information videos or any app that's going to say this is all you're going to get is a nursing education now in 3 days. And they sort of feel like they need that.
Mm-hmm.
And so they don't. But sometimes the biggest thing I see is people have no idea the questions to ask.
Right.
And I think that's really it.
I
so
think
they're sitting there feeling so afraid, and they don't even know what to begin to ask. Whereas, I think one of the good models that we've had, a better model, we should say, we're still working on it, but the better models of care might be that hospice model. If we could take that hospice model of teamwork and let's help you figure it out, that doesn't always exist in all the other sides of the professional world. We know that, but can't be but that much. And I see that that gap as being sort of the secondary and what people think they can get out from the world or from our government, or from even what they think in the moment they can get from down the street from some place they saw that said they would give you some home care, just give us a call.
Yeah.
So I think though, between feeling alone and that they're doing it by themselves, not knowing the right questions to ask, something very invaluable that someone gives you suggestions for your situation. And also, maybe they don't even know what to ask, what is available to them.
Mm-hmm.
You know how many people that could have home care paid for, even by insurance or not, is they don't even know that. And somebody in the hospital has not done an appropriate discharge to let you know what are all the things that are available to you. And so you were sitting there totally alone.
Yeah. So one of the things you just said that kind of rings true for me is that sometimes the hospitals are, somebody in the hospital didn't give enough information at the time of discharge. So I just want to go on record saying hospitals are not bad. We're in a national nursing shortage. We're in a national direct care support shortage. We, according to all of the studies that we've read, we know that there's lots of great organizations that we can point you to, but that I think the number is 7.6 million direct support care staff is going to be needed in the next 10 to 15 years, 20 years. Anyway, it's amazing to me how, we want the healthcare system to tell us everything and to tell us what we do, but folks, they're human too. Being on the clinical side of things, there's not enough time in the day with the boomers hitting the system, so to speak, and the nursing shortage nationally, and now we have a national labor shortage because of COVID. Like, it's just, we as caregivers, and I think part of the urgency of our work together is because people have to become more self-sufficient and more informed in this particular kind of perfect storm moment, and understand what the kind of the phrase that we use in the clinical world is scope of practice. Where does my role end and where does somebody else's begin, and how much is somebody able to do, and what are the boundaries? And so as a caregiver, I know that my expectations of what maybe the skilled nursing facility could or should do for a loved one may have been overinflated. Maybe I didn't understand exactly what the rules were around that, or maybe, and going through a grief journey at the same time, because I was losing someone I loved, that just heightened my anxiety. So we respect the sort of the both sides. I don't want to, there's no blame shifting here as far as that goes. We just know that the system has evolved into this place where there's all these unintended consequences. There's a lot of good people, but there are some people who don't know necessarily, if they're working in a particular nursing role, how to get a veteran's benefit and what the paperwork is that's required, or that down the street there's a foundation that can fund a specific need that someone has. So that's where we want to hear people's stories and understand a little bit more about who they are, where they're coming from, what kind of team support they're looking for, and I think that's part of it. And also, how one of the concerns I think about that you're going to be an invaluable support person for us is how do we stay as caregivers when we don't have we can't afford 24/7 care, we don't have to, how do we stay safe in our homes as caregivers, like taking our loved one to the restroom, or hygiene issues or food issues? Like, what do we need to know about those kinds of things? And for me, that's why I'm so excited to have you on the team, because that's the benefit of and we're not just talking about elderly folks, but we're talking about any kind of caregiver need. What are the things that you need to know? So what are some examples of like what I'm trying to say?
Yeah, well, I do know that for lots and lots of clients and people professionally and personally that I've known have had incidences, like I said, for instance, somebody in your family gets very, very sick. You're not quite sure why they're acting sick, being really sick. You finally get to a doctor, they finally find out that they have diabetes. And there's a whole lot for you, the caregiver, to learn or take in, figure out, if you can, which people might help you do that. Because, oh my God, it's so overwhelming if I have to learn about the shots and everything about the disease. And I'm taking care of my granddaughter at home. Mm-hmm. I'm taking care of 3 grandchildren at home. Oh, 2 of them aren't in school yet, So that is where there's never enough, your 24-hour day suddenly becomes double that, at least what it feels if you're doing it by yourself. It would just be so overwhelming. And that doesn't involve someone end of life that's been said they were appropriate for hospice. So you see that just somebody that's might even be living at home at 25 with 2 young children. She's living with maybe mom and or dad, and they maybe are on a fixed income, or for someone, something happened to them. Let's say they just broke their leg, but they've healed enough to be out of the hospital. They've gone to rehab. They've got such a bad break, they have to be fairly bedbound, for let's say even another couple of weeks. Then you also have people who are not in hospice ready, but are unfortunately just been diagnosed with Alzheimer's. And maybe the family manages to piece it all together in those first couple of years as there's some decline. But as it goes on and on, it's exhausting. And one person cannot possibly take care of a person with dementia. You're worried they're going to run out of the house. They're eating differently. Their whole behaviors change, which is severely emotional for each person. And then just keeping them, like you said, safe. They've stopped learning how to do their hygiene. There are so many things. And I think part of it is that thinking ahead about all the things. Like somebody gets a diagnosis, let's immediately help you think out, okay, what are we going to do? What my husband likes to say, as a type of a benefits educator himself, is that that knowledge is power. Mm-hmm. And that, lack of knowledge, he uses the word ignorance, but sometimes it's not really true ignorance. It's just lack of knowledge will usually cost you way more monetarily, emotionally, spiritually. If you can think ahead and let us help you, you might be a little ahead of the game. Most people only think in crisis. That's very human.
Yeah.
And ourselves included at times.
Yeah, you say that, but you know, we do things like we'll buy flood insurance and fire insurance and health insurance, and we buy all these insurances, but some of the best insurance for a caregiver is, again, like you said, learning. But the problem is, and knowing where to go for help, but part of the time, I call caregivers time starved, right? And I talk about, especially around different time, like time vampires. What are the things that are sucking away the time from caregivers, which there's just so many. But if I have to go to all these wonderful places, but there's 500 of them to get the information, I'm absolutely clicking on websites for 45 minutes and never finding what I need to, not because the information isn't good, but because what I'm specifically looking for as a unique individual is, and for my specific family concerns, is not readily available. Or and as much as I love automation, and I think it's fantastic, that and I'm amazed with what's going on in the world of technology. Like, it's just going to be great in so many ways. The things that are being designed right now are just spectacular. However, they don't necessarily always fit the individual. So how do we, how do we address that at ground zero in our communities as caregivers? And what does it mean when we are on a particular path and a state rule changes? Or what does it mean when I have two doctors that disagree on a diagnosis? Who's going to talk to me about that? I don't know how to find that. Or, so we try and provide with these tips, which are just little nuggets of information, right? There's those little tips that they just are either email or as we build our wraparound teams and as we do that education, it helps. And whether we're providing these to an organization or whether we're providing them to family members and friends, to just begin to learn and inform yourself. I was just thinking that it's Medicare enrollment time, right? And the Medicare book came out, the 2022 book came out, and it's an inch fat, and there's a lot of really good information there. But there's so many other organizations. There's their finance, there's the financial advisors, there's your wealth managers, there's your corporations. Some people have benefits in their companies and they don't even know because they never asked, or they forgot when they were hired, or they don't know how to access them. There's money in long-term care policies that people are leaving on the table because they just don't know. So it's not just the nursing, there's all these other silos. So when somebody's scope of practice stops, we can maybe bring people together, hear what they need, and then gently say, yeah, well, we've never heard of that before. Give us a couple days to try and talk to our teams of networks and folks to find it. But then if we do know somebody, or we have somebody with, right on our staff, we can get them to that person and get them that connection, or call up our person and say, hey, I've got this going on for this person. Can you help? So we're trying to kind of collapse the time frame, which then will free people up to actually do the caregiving, right? And spend, if you're always running around trying to figure things out, as you're losing someone, you don't have that spiritual, emotional time to sit and have those meaningful conversations either, right? Or, you don't have time to talk about what may or may not be working with a person, right? So if we can find ways together to help folks plan ahead, be more efficient, save some time, save some money, address the particular, I think that's kind of the mission and the goal of the project. And we think that the more we connect with people and their stories, the more beneficial it's going to be. And
yeah, I mean, you've made me think of a couple of things that just would be further examples for anybody trying to get to know us and tune into us, to sort of think, well, what would be another example? How might I need somebody? And it can just come down to that bottom line of, I'm about to pull my hair out because for the first day since Dad's been very sick with coronary artery disease, suddenly his legs just aren't working. They aren't working. He's trying to get up and go to the bathroom. I'm dealing with falls. Then there's diarrhea. I don't even know how to do this. I can't go over there and read that app, or I can't go over there and call somebody. I might say, oh, there's a change in behavior or something going on, to a doctor, but he might not, for all the right reasons, be able to get back with you until 4 o'clock, unless it's urgent and you don't want to necessarily take that person to the ER for weak legs and diarrhea. You need somebody to call to go, where do I even start? Do I have a caregiver or not? Have I already ahead of time, before the crisis, thought it might need to be one of me at certain times? Maybe my time vampires are taking so much time that I can't even go for a walk. I can't walk the dog. I can't, forget sanity. I have to send somebody out for groceries. Maybe that's what you need, somebody going out for groceries. All these things that are happening in your regular life until the crisis hits. And then you realize that everything you can think of pretty much is, how am I going to manage this and get help doing it? Yeah. A secondary example from what you were talking about is the money on the table part. And it's a very personal thing, but it's not unusual just to my mother. But my mother took care of my father with Alzheimer's for 15 years. She used all his long-term care insurance. Thank God they had it. Could never have done it without it. They were lucky to sign up at a certain time and were able to do that. However, my mom had it too. My mom was diagnosed with colon cancer, inoperable everywhere. She decided, good life, just going to get care that I need. She was paying some individuals that she knows just a little bit to come and help her when she needed, and she didn't want to touch her long-term care because, that's long-term, I might need it. Meanwhile, it's the staff trying to remind her and all of us that they basically think it might be 6 months before the disease takes her. She never touched it. So when she died, she had tons of money sitting on the table of long-term care because she didn't, and partly the family did not want to admit that she use it now and worry about later. So those kind of things happen that we know about. Mm-hmm. I said professionally and personally, and we just know the right questions to ask. Mm-hmm. And then from experience, hopefully say, we don't know your case. We can't be totally yet in your moccasins, but we have had some experience with like things. And we sure hope we can help you on that part.
Yeah, right. And we don't have a magic wand, but we have duct tape. In some cases, yeah. and there will still be gaps. There will always be gaps because the system is fluid, it's moving, things are always going to be happening. But our goal is to be able to take what we do know and take the knowledge from each other. And then as we have things that are for sure, like we know that you need a DD 214 if you're going to get a veteran's benefit. So if you're a caregiver of a veteran and you don't know what that is, that's an example of where you would possibly need to educate yourself. Get onto our tips program, connect with some of our classes, email us at answersforcaregivers@gmail.com and say, hey, this is kind of a concern I have. Do you have anything coming down the pike for that? And we're building as fast as we can and providing a lot for the people with whom we're connected. So I'm just so thrilled you're part of the team.
Thank you. I'm looking forward to working with all of you.
Yeah, thank you so much, Laura Leigh. I appreciate your time today. And we also know that every family on our team and every other team in this country, every working person and working at home person, has caregiving issues. And they are time consuming and costly, and we want to try and do everything we can to help you be more efficient and live a more peaceful life and take care of yourself while you're doing your caregiving. So blessings today and take it
Yeah.
easy. Okay,
Thank you.
We'll talk soon.
Yeah. Bye.
All right.
Recording off?
Let me see. I don't
Well, I
know.
guess you can